Good afternoon, and thank you for joining us today for the updated SNF QRP Achieving a Full APU webinar. My name is Jackie Stempinski from Econometrica, and I will be your host and moderator for today's presentation. If you would like to download today's presentation, you can follow a link that is in the chat. It'll be posted periodically if you've missed it. Before we proceed, I'd like to take a moment to review the disclaimer for this training. This presentation was current at the time it was published or uploaded onto the web. Medicare policy is subject to change, so links to the Skilled Nursing Facility Quality Reporting Program web pages have been provided as supplemental resources for your reference. This presentation was prepared as a service to the public and is not intended to grant rights or impose obligations. This presentation may contain references or links to statutes, regulations, or other policy materials. The intent of the information provided is to be a general summary and not to take place of either the written law or regulations. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. Today's agenda will include an introduction to our speakers and review of the following topics, including the SNF Quality Reporting Program, the MDS and CDC National Healthcare Safety Network, NHSN Submission and Reporting Requirements, the iQIES, SNF QRP, and NHSN CMS reports, determining compliance with the SNF QRP, and a review of available resources. Finally, we will wrap up with a question and answer session. Now I would like to introduce today's presenters. Our first presenter is Heidi McGladrey. She is currently a CMS Skilled Nursing Facility Quality Reporting Program Lead. Heidi is a registered nurse with over 25 years of experience, and prior to joining CMS, she spent 13 years working in the home health industry as both a visiting nurse and nurse supervisor. Our second presenter is Teresa Mata. She has over 30 years of experience in geriatric nursing and is currently an associate nurse researcher at APT Global. Prior to joining APT, Teresa worked for CMS as a post-acute care subject matter expert in quality measure and standardized data assessment development across post-acute care settings, assisting with the implementation of the IMPACT Act. The objectives for today's training include recalling the basics of the SNF QRP, identify the data submission requirements for the MDS and NHSN, describe the steps related to MDS data submission and acceptance in iQIES, discuss the application of various SNF QRP iQIES reports, describe the impact of SNF QRP data submission on the annual payment update, and list at least 2 resources to help monitor your compliance and achieve a full APU. During the event, a navigation panel is available at the bottom of your screen and will allow you to send messages and reach out for assistance in the chat. Alternatively, you can ask questions through the Q&A. Links will be provided in the chat, and resource links and a list of acronyms can be found at the end of this presentation. As a reminder, today's event is being recorded. Now let's try out the polling function with these next 2 questions. These questions will be collected anonymously to get a better idea of attendee experience. You should now see the polling question pop up with the responses in a separate window on your screen. We will allow a few moments as responses are collected for each polling question as we go throughout this presentation. Okay, and then for our next question, we have here, how long have you been in your current role within a SNF setting? And there are responses below. Okay, so this was just a trial and practice of these polling responses. Throughout the webinar, we will have multiple other polling questions related to the event. We can move on next, and we're going to jump in to this next session, and I'm going to hand it over to Heidi.
Thanks, Jackie. So let's just start by jumping in and reviewing the background of the SNF QRP. The SNF QRP was established by CMS in the fiscal year 2016 as mandated by the Improving Medicare Post-Acute Transformation, or the IMPACT Act, of 2014. The Impact Act mandates the use of standardized assessment data elements with regard to quality measures that are publicly reported for post-acute care settings, including SNFs. The SNF QRP promotes the delivery of person-centered, high-quality, safe care by SNFs. CMS leverages a number of approaches to improve healthcare across the country, including quality measurement, public reporting, value-based payment programs and models, establishing and enforcing health and safety standards, and providing quality improvement technical assistance. In 2022, the agency launched the CMS National Quality Strategy, an ambitious long-term initiative that aims to promote the highest quality outcomes and safest care for all individuals. The CMS National Quality Strategy focuses on a person-centric approach from birth to the end of life as individuals journey across the continuum of care, from home or community-based settings to hospitals to post-acute and across payer types, including traditional Medicare, Medicare Advantage, Medicaid, and the Children's Health Insurance Program and marketplace coverage. The CMS National Quality Strategy builds on previous efforts to improve quality across the healthcare system, incorporates lessons from the COVID-19 public health emergency, and addresses the urgent need for transformative action to advance towards a more equitable, safe, and outcome-based healthcare system for all individuals. The CMS National Quality Strategy has 4 priority areas, each with 2 goals, as depicted in the circles in the center of this slide. These 8 focused and interrelated goals include embedding quality into the care journey, advancing health equity, promoting safety to achieve zero preventable harm, fostering engagement to improve quality and build trust, strengthening resiliency in the healthcare system, embracing the digital age, incentivizing innovation and technology adoption to drive care improvements, increasing quality measurement alignment to promote seamless and coordinated care. The success of this strategy relies on coordination, innovative thinking, and collaboration across all entities. A unified approach brings us all one step closer to the healthcare system we envision for every individual. Now let's focus our scope back in on the SNF QRP and consider the data submission requirements for this program. Data for the SNF QRP are derived from 3 sources: the Minimum Data Set, or MDS, Medicare Fee-for-Service Claims, and the Centers for Disease Control and Prevention National Health Safety Network, or NHSN. Let's walk through each of these data sources. For a Medicare Part A SNF stay, all Medicare certified SNFs are required to collect and submit data from the MDS at the start of care and upon discharge. This includes consecutive time in the facility, starting with a Medicare Part A admission through discharge from a Medicare Part A stay or upon death. MDS data are required to be submitted and accepted according to the established submission timelines and thresholds. These requirements are found outlined in Chapter 2 of the Minimum Data Set Resident Assessment Instrument 3.0 User's Manual. The current version of the manual is available on the Minimum Data Set 3.0 Resident Assessment Instrument Manual page, and the link to this page will be shared at the end of the program during our discussion of available resources. Let's consider the other 2 data sources for the SNF QRP. In addition to the MDS data, the SNF QRP uses Medicare Fee-for-Service claims. These are submitted by SNFs for payment. Because the data for the SNF QRP claims-based measures are collected from the claims directly, there is no additional data submission requirement for the provider. The final and newest data source for the SNF QRP is the CDC NHSN. SNFs currently submit data for two measures in the NHSN. Those are the healthcare personnel vaccination measures for both influenza and COVID-19. One of the critical pieces for a provider to understand is the relationship between the collection and submission of data and the APU lifecycle. I think the easiest way to think of this is to remember that calendar year data impacts fiscal year APU 2 years later. So in this example, calendar year 2023 data impacts the fiscal year 2025 APU. In addition to understanding the relationship between the timing of data collection and the APU impact, it's important to be aware of key milestones within the life cycle. On this slide, you see a snapshot of the fiscal year 2025 APU cycle, which is the current cycle. In the blue block, you see that the provider collects and submitted the data January 1 to December 1 of 2023. Moving to the right, you see that during the first half of calendar year 2024, CMS is making compliance determinations. This may seem like a long time after the end of the 2023 calendar year, but remember that SNFs have 4.5 months after the end of the quarter to submit the data. This means the fourth quarter data, in this case October 1 to December 31, 2023, does not have to be submitted until May 15th of the following year, in this case May 15th of 2024. Moving to the right, one more, you see that in June and July, CMS sends non-compliant letters to providers. It is important to note that CMS does not send letters if a provider is compliant. In this case, no news is, in fact, good news for the provider. In the light blue box, you see that those SNFs received a notice of noncompliance have an opportunity to complete a reconsideration request. The reconsideration request, however, must be submitted to CMS within 30 days from the date at the top of the noncompliance notification, and it must be submitted via email. Continuing to the right, if a SNF submits a reconsideration request, they will receive a response from CMS informing them of the CMS reconsideration result, either to uphold the original determination of noncompliance or to overturn the original determination. And finally, as I stated in the beginning, the compliance or noncompliance determination will impact the payment the SNF receives for the fiscal year 2 years later, in this case, fiscal year 2025. Now that we understand the APU life cycle, let's move on and look at the specific MDS and NHSN submission and reporting requirements. I'm sure most, if not all of you listening today, are familiar with the MDS. It is a core set of screening, clinical, and functional status data elements, including common definitions and coding categories, which forms the foundation of a comprehensive assessment for all residents of nursing homes certified to participate in Medicare or Medicaid. The data elements in the MDS standardize communication about resident problems and conditions within nursing homes, between nursing homes, and between nursing homes and outside agencies. The MDS serves many purposes, including care planning, survey and certification, payment via the prospective payment system, Medicaid payment in some states, and quality and value-based programs. All Medicare certified SNF providers, including non-critical access hospital swing bed facilities, are required to submit MDS admission and discharge records or assessments for the SNF QRP. For SNFs, those records are the nursing home PPS or the NP at admission and the nursing home Part A PPS discharge or NPE at discharge. For non-critical access hospital swing bed facilities, those records are the swing bed PPS or SP at admission and the swing bed discharge or SD at discharge. MDS data are collected and submitted to iQIES for all residents admitted to a Medicare Part A SNF stay. The majority of the SNF QRP MDS-based measures utilize data on the admission assessment and the corresponding discharge assessment. And again, the NP or SP is the first assessment completed when a resident enters a SNF or swing bed facility for a Medicaid Part A stay. It authorizes payment, but also provides data required for the SNF QRP. The NP or SP must be completed within 14 days after the assessment reference date and submitted and accepted into iQIES within 14 days after the assessment completion date. The NPE or SD is completed when a resident's Medicare Part A stay has ended, regardless of whether the resident remains in the facility or is physically discharged. The assessment provides data to be collected on discharge for the SNF QRP. The NPE or SD must be completed within 14 days after the end of the most recent Medicare stay. The assessment must be submitted and accepted into iQIES within 14 days after the assessment completion date. I want to pause here to say that while most of the SNF QRP measures utilize the admission and discharge assessments, there is one quality measure, the application of percent of residents experiencing one or more falls with major injury, which looks at all qualifying assessments within the entire SNF stay to determine whether a resident has fallen since admission. This type of a review is called a look-back scan. Now, in addition to collecting the data on the appropriate MDS admission and discharge assessments, SNFs must submit the data into iQIES by the data submission deadline to comply with the requirements of the SNF QRP. The data submission deadline is 4.5 months following the end of the calendar year quarter. Sometimes the data submission deadline goes beyond the 15th of the month if the 15th falls on a weekend. You can see detailed information about the SNF QRP data collection submission deadlines by going to the Skilled Nursing Facility Quality Reporting Program Data Submission Deadlines page. And as we already stated, MDS records must be submitted into iQIES, and the CMS iQIES MDS Upload and Assessment Users Manual is an important resource for providers. We should note that the iQIES system confirms that the submission was received and includes the name of the file submitted. However, it is important to note that submission does not mean the data were accepted. Files that contain fatal errors may be rejected. The MDS 3.0 Nursing Home Final Validation Report, which can be obtained from iQIES, will verify acceptance or rejection of MDS records. So to summarize, to meet the SNF QRP reporting requirements as it pertains to the MDS reporting, SNFs must meet the MDS data collection requirements, submit MDS data on time per the submission deadlines, and ensure the MDS data are accepted into the iQIES system. Now let's move on to another data source for the SNF QRP, the CDC NHSN. It is the nation's most widely used healthcare-associated infection tracking system. It provides facilities, states, regions, and the nation with data needed to identify problem areas, measure progress of prevention efforts, and eliminate healthcare-associated infections. In addition, NHSN allows healthcare facilities to track blood safety errors and important healthcare process measures, such as healthcare personnel influenza vaccine status. There are currently 2 measures adopted for the SNF QRP that use data submitted through the NHSN. These measures are influenza vaccination coverage among healthcare personnel and COVID-19 vaccination coverage among healthcare personnel. Let's first look at the NHSN submission requirements and deadlines for the healthcare personnel flu vaccination. Providers are required to report influenza vaccination coverage among healthcare personnel measure data through the NHSN Healthcare Personnel Safety, or HPS, component. For this measure, SNFs are required to submit one report at the end of the influenza season that covers the entire influenza season from October 1, 2023 to March 31, 2024. That's for this season. The deadline for reporting is May 15th, 2024. So if we think about today is March 26th, and the 2023-2024 influenza season ends this Sunday, March 31st. So your agency should prepare to submit the one influenza report covering all healthcare personnel flu vaccinations from October 1, 2023 through March 31st, 2024 by May 15th, 2024. I would urge providers to get this data reported sooner rather than later, especially if you as an individual have never reported this data into the NHSN. We've provided a link here for the healthcare personnel flu vaccination page. On this page, you'll find helpful training materials, including protocols, data collection forms, frequently asked questions, and training slides, which you can find located under the facility-specific training slides. Now let's look at the NHSN submission requirements and deadlines for the healthcare personnel COVID-19 vaccination. Providers are required to report data on the COVID-19 vaccination coverage among healthcare personnel measure to meet the requirements of the SNF QRP in the CDC NHSN long-term care facilities component. The COVID-19 vaccination coverage among healthcare personnel measure previously collected data on healthcare personnel who received a full vaccination course. Due to the continued presence of SARS-CoV-2 in the United States, including variants, CMS updated the specifications of this measure to refer to healthcare personnel who are up to date with their COVID-19 vaccination. Up to date means that as of the first day of the applicable reporting quarter, the healthcare personnel received a 2023-2024 updated COVID-19 vaccine. The CDC has a helpful quick reference guide for reporting up to date COVID-19 vaccination status through the COVID-19 vaccination module. For the purposes of meeting the fiscal year 2025 SNF QRP compliance, SNFs began reporting these data for healthcare personnel who were up to date with their COVID-19 vaccination beginning in quarter 4 of calendar year 2023, which covered September 25, 2023 through December 31, 2023. Subsequent data collection for this measure runs from January to December. Submission deadlines for each quarter are listed below and mirror the MDS data submission deadlines. We've provided a link here for the long-term care facility COVID-19 vaccination page. And on this page, you will find training materials, including protocols, CSV files, quick reference guides, data collection forms, frequently asked questions, and training slides. I want to take a moment here to speak to those listening from swing bed facilities. While all Medicare certified SNF providers, including non-critical access hospital swing bed facilities, are required to collect and submit SNF QRP data, for the two NHSN healthcare personnel measures, data reporting is required under the parent hospital CCN only. There is no additional reporting requirements for these swing beds under the SNF QRP. As a reminder of the information presented earlier in this presentation, since Medicare fee-for-service claims are submitted by SNFs for payment, and the data for the SNF QRP claims-based measures are collected directly from the claims submitted, no additional data needs to be submitted to CMS, and there are no associated submission deadlines like the ones we looked at for the MDS assessment-based measures and the CDC NHSN measures.
Okay, we're going to try a couple of polling questions now to see how everybody's doing, since that was a lot of information. So for our first polling question, how often do MDS data submission deadlines occur for the SNF QRP? A, weekly, B, monthly, C, quarterly, or D, yearly? If you are a visual learner, you might remember that the blue and white chart we showed earlier outlined this information. The correct response is C, quarterly. Data submission deadlines for SNF QRP occur quarterly on the 15th of August, November, February, and May of each year. For our next polling question, where do SNFs submit MDS data for the SNF QRP? The options are A, Nursing Home Survey Data Center, B, Centers for Disease Control and Prevention, C, the Quality Manager at the SNF, D, iQIES. Okay, we'll share the results. And the correct response is D, iQIES. The key to this question is MDS data, because it is the MDS data that is submitted through iQIES. And with that, I will hand the presentation over to Teresa Mata.
Thanks, Jackie. So in this section, we'll go over the SNF QRP quality measures, the APU data submission thresholds, the SNF QRP provider reports, and how to access them. So first up is the information about the assessment-based quality measures currently adopted for the SNF QRP, and whether higher or lower percentages are better for each of these measures. As you can see, of the 5 measures noted on this slide, the falls with major injury and the changes in skin integrity pressure ulcer injury measures. Note that lower numbers are better, which makes sense, right? These are issues that we don't want to see high numbers on, because the pressure ulcer injury measure looks at the development of new pressure ulcer injuries or existing pressure ulcer injuries that worsened during the SNF stay. And the falls with major injury measure looks at residents who experienced 1 or more falls with major injury during the stay. The 3 other measures on this slide, the drug regimen review and the application of IRF discharge self-care and mobility score measures, show that higher percentage is better. And we want to see higher percentages for these measures because, for example, we definitely would want reviews of medication conducted at admission and during the stay, as well as a follow-up if there are any identified issues related to that person's medication. And we would also hope that on discharge, a person's self-care and mobility function would be at or above their expected scores from what they were admitted. The measures on this slide are the last 4 assessment-based quality measures for the SNF QRP. As you can see, for all of them, we want to see higher percentages. It's important that providers and patients and residents are receiving at least a reconciled medication list prior to discharge, and that their discharge function score is at or above an expected score at discharge. For the COVID-19 vaccine measure, we want to see the percentage of this higher, because we want to see that residents are up to date on their receipt of this important vaccination. I'll talk a little bit more about that particular measure in a bit. We're going to pivot now and talk about the 4 Medicare fee-for-service claims-based quality measures. As Heidi mentioned, these data come from claims, so there's no additional data that SNFs need to submit. There's one measure here that we want to see higher percentages on, and that is the discharge to the community, because we want to see those successful discharges back to the community without a subsequent unplanned hospitalization. We also want to see that our 30-day post-discharge readmission rates are low, because a higher number could indicate that we might have been able to prevent whatever the issue or condition was that caused the readmission. And finally, we want to see the healthcare-associated infections that required hospitalization measure results low, because it reflects an infection that was acquired in the SNF that resulted in an acute care hospitalization. The Medicare spending per beneficiary quality measure is a measure that's displayed as a ratio. The measure itself reflects whether Medicare spends about the same, more, or less on an episode of care for a resident in a specific SNF compared to all SNFs in the nation. To interpret the ratio, you need to understand that the ratio that is equal to the national average means that Medicare spending in the SNF was about the same as all SNFs in the nation. A ratio that's greater than the national average means the spending was more, and a ratio that's less than the national average means the spending in the SNF was less. The idea is that tracking these data will help CMS support SNFs in coordination of care and make care more efficient. And finally, let's look at the two measures adopted for the SNF QRP, which are entered into the CDC's NHSN. Both of these measures are healthcare personnel vaccination measures, as Heidi mentioned. And like the COVID-19 resident vaccination measure I just mentioned, we want to see these percentages higher versus lower because we want to ensure that those caring for residents are protected as much as possible from contracting and or spreading these two illnesses, as we know that both of these can cause really severe illness or death. This slide provides a quick at-a-glance summary of the changes related to quality measure and or reporting that occurred with the finalization of the fiscal year 2024 SNF QRP rule, and in which fiscal QRP these changes apply. There were three measures that were added for reporting in the fiscal year 2025 QRP, and they are the two transfer of health measures for providers and patients and the discharge function score measure. There were three measures that were removed from the SNF QRP for fiscal year 2025, including the application of the percent of long-term LTAC patients with an admission and discharge functional assessment and care plan that addresses function, and the application of IRF functional outcome measures for changes in the self-care and mobility scores. Reporting for one measure was modified that affects the fiscal year 2025 APU, and that's the COVID-19 healthcare personnel measure. And finally, the new measure that was finalized in the fiscal year 2024 SNF QRP rule, which affects the fiscal year 2026 APU, the COVID-19 vaccine percent of residents up to date. Data collection for this measure will begin with residents discharged on or after October 1st of this year, using a new data element that will be added to the MDS. Public reporting for this measure will begin in October of 2025 or as soon as technically feasible. Just to further clarify, the COVID-19 vaccination coverage among healthcare personnel measure was modified to report healthcare personnel who were up to date with their COVID-19 vaccination. The prior measure reported vaccination with the primary series of the COVID-19 vaccine. SNFs began reporting these data, as Heidi said, in quarter 4 of calendar year 2023, which covered September 25, 23 through December 31st of 23. The definition of up-to-date can be found on CDC's COVID-19 website under vaccines. It's important to note that CDC will update these recommendations as needed. So be sure to become familiar with these recommendations and check in periodically to CDC's website to know which vaccines qualify as up-to-date. Okay, we're going to switch gears a bit and go over the new APU data submission thresholds. As you are all likely aware, the SNF QRP is a pay-for-reporting program, not a pay-for-performance program. So the APU determination is based on the submission of the data and the data used to calculate the quality measures, and not on the quality measures themselves. As Heidi mentioned when she discussed the SNF QRP lifecycle, there's generally a 2-year delay between when data are collected and the fiscal year application of the APU. So, for example, data collected in calendar year 2023 is used in support of the fiscal year 2025 APU, and the data collected this year will be used in support of the fiscal year 2026 APU. Remember that in order to be counted, the MDS data need to be submitted and accepted into iQIES, and the data for the NHSN measures need to be submitted through CDC's NHSN within their accepted thresholds. Remember that there's no need to submit additional data for the claims-based measures. So in order to be compliant with the SNF QRP, SNFs must meet or exceed 2 separate data submission thresholds. As you know, from October 1st, the 23rd to December 31st, 23, 80% of the data submitted to iQIES had to contain 100% of the required measures and standardized resident assessment data. However, starting January 1st through September 30th of this year, 90% of the MDS data submitted to iQIES must contain 100% of the required measures and standardized patient assessment data. The second threshold that SNFs must meet is for NHSN data. And that threshold is 100% of the data submitted to the NHSN has to contain 100% of the data required for the CDC NHSN measures. If SNFs fail to submit these data by the APU submission deadlines, they are subject to a reduction of 2 percentage points to the applicable fiscal year APU, beginning with fiscal year 2026. This slide lays out in a table format the versions of the item sets, their effective dates, and reporting periods covered for both the fiscal year 2025 and fiscal year 2026 SNF QRP APU determinations. If you would like to see which specific data elements are related to the fiscal year 2025 and 2026 APU, you can check out the APU tables available on the SNF QRP Measures and Technical Information webpage. And this table shows the MDS calendar year from which MDS data are collected, along with the SNF QRP data submission thresholds for MDS and NHSN, and to which fiscal year APUs they apply.
Okay, for the next polling question, we will start with what is the MDS APU threshold for data collection in calendar year 2024? The options are A, 80%, B, 90%, C, 95%, or D, 100%. Okay, I think we can go ahead and share the results. And the correct response for this question is B, 90%. Of course, we just went over that threshold has increased from 80 to 90%. So I'm glad to see that most are getting that one right. Okay, we'll hand it back over to Teresa.
Okay, let's turn our attention to the iQIES SNF QRP reports and the CMS reports that are available through NHSN. So this slide depicts overall the different types of reports and reporting for assessment and claims-based measures in the relationship to public reporting. On the far left, in the peach-colored area, these are the confidential reports that are available to providers and iQIES. These reports help to monitor and review progress on the measures and APU compliance. I'll point out here that the Review and Correct report doesn't contain claims-based measures. The quality measure reports do, but only at the facility level. On the right, in the green-colored area, you'll see that the provider preview reports straddle both confidential reporting and public reporting. And this is because the actual report is confidential to providers, but it does offer a preview of the measures that will be publicly reported on Care Compare, which, as you can see, is on the far right of this graphic under public reporting. So we'll go over the purpose and details of these reports in this part of the presentation. First, let's look at how iQIES reports are accessed. After logging into iQIES, facility reports can be accessed from the Reports drop-down menu. Following the alphabet indicators on this slide, I'll go over what each of the drop-down sections mean. For A, under Reports main, providers will be able to see a list of frequently run reports. Under B, Find a Report, providers will be able to access user-requested reports, such as the SNF Provider Threshold Report, SNF Quality Measure Reports, SNF Review and Correct Report, and user-requested Final Validation Reports. For C, My Reports, providers can access system-generated, automatically distributed reports, such as the Nursing Home 3.0 MDS Final Validation Report and the SNF Provider Preview Report. And finally, under D, Report Activity, selecting this allows providers to view the entire list of personal report activity. Now that we know how to access reports, we'll go over these 4 reports in more detail. The MDS 3.0 Nursing Home Final Validation Report, or FVR, is an automatically generated report in iQIES that's available within 24 hours of the submission of a file. This report is placed in the provider's MDS 3.0 Final Validation Report folder, which, as I mentioned, can be accessed from the My Reports webpage in iQIES. This report provides detailed information about the status of select submission files. As I've mentioned previously, it's critical for providers to ensure that submitted records have been accepted into iQIES because just submitting the reports doesn't mean they were accepted. Both submission and acceptance of the records is important when it comes to compliance with the SNF QRP requirements. If a record gets rejected, the facility must correct the errors identified in the FVR and submit the record to iQIES. Failure to correct and resubmit those records may jeopardize compliance not only with the SNF QRP, but it may cause issues with the nursing home quality improvement quality measures. The FVR will indicate whether the records submitted for each file were accepted or rejected. It details the fatal file or record error warning messages that the system encountered. While the FVR is auto-generated, as I mentioned, it can also be user-requested. One reason for this is that the report is only available in the system for about 60 days. So if the report is removed from the system folder before it's printed or saved, the provider can actually rerun the report. It's very important that providers make a habit of going into iQIES after each submission to access the FVR for that submission. It needs to be part of a regular process to review the errors and warnings generated and to take action on that information. And so this is just a screenshot of how you access the system-generated FVR. So again, once you're logged in, you go to My Reports and click the down arrow to select that. And once you're there, you'll see the access link to the MDS 3.0 Final Validation Report folder. And as I mentioned, FVRs can also be user-generated. And there are actually two different types of user-generated FVRs that can be accessed. The first is the MDS 3.0 NHFVR, which we've already discussed. But the second is a submitter FVR, or SB-FVR. The data for the submitter FVR is only returned if the submitter of the file requests it. So this screenshot from iQIES shows how to access either of these FVRs. Again, you would start at the Reports dropdown, and under Report Category, depending on which FVR you'd like the system to generate, you would choose either Provider or Submitter, and then the Validation Report type, and select Find a Report. And here's an example of what a nursing home FVR looks like. As you can see underneath the submission and facility information, there's a section that shows the total number of records processed for that particular submission, as well as a series of color-coded bars. In the green bar, providers can see how many records were accepted, in the red bar, how many records were rejected, and in the yellow bar, information on any duplicate records. So for this particular submission, under total number of messages, there were no system messages flagged. But had there been any, the total number of messages would be displayed there, and each of the records listed on the report would show whichever message was returned by the system. So let's talk a little bit about the types of messages returned by the system on the FVR. There are two types, errors and warnings, and these are intended to help identify issues with MDS submission and acceptance. There are many conditions that may prevent a file or record from being successfully submitted. The FVR will inform providers whether the error that occurred upon the submission was fatal, meaning that the record wasn't accepted, or a warning, meaning that the record will be accepted, but the data submitted may be something to review or ensure its accuracy. For example, it might be that a dash was entered in a particular data element that may affect the APU. So that's just going to give you a warning as to something you may want to take a look at. Each error or warning has an identifier that can actually be cross-referenced in the CMS iQIES MDS Error Message User's Guide. This guide lists all of the error and warning identification numbers, and it actually includes guidance for correcting the errors if necessary. This guide is available on the QIES Technical Support Office QTSO website. Remember that all fatal errors in a file have to be corrected and those file records resubmitted. Identifying and correcting these issues helps providers maintain SNF QRP compliance. Now I'll talk about how a fatal file and fatal record errors are discovered by the system. For fatal file errors, as the submitted file structure is checked against MDS data submission specifications, if the file doesn't meet those specifications, it'll be rejected. Examples of fatal file errors could be that the file was submitted as a single record and not contained within a zip file, or the file couldn't be read for some reason. The system-generated FVR is provider-specific, and the submitter FVR is user-specific. Because of this distinction, fatal file errors are only displayed on the submitter FVR. This is because the system can identify the specific user that submitted the data for that file. Since the system-generated FBR is provider-specific, it makes sense the system wouldn't be able to identify the provider to which the user submitted file belongs. And remember again that files that are rejected due to fatal errors must be corrected and resubmitted. A file can also be rejected if a record within the file contains a fatal error. Again, these errors are identified as each record within the submission file is checked against the data specifications. Examples of a fatal file error might be an out-of-range response. So if a response that the system is expecting is a 1, 2, or 3, but the value submitted was a 6, that would be rejected. And another type of fatal error might be an inconsistent relationship between date items, such as having the resident's birth date later than the admission date, or not following a skip pattern correctly. Like fatal file errors, fatal record errors cause a file to be rejected by iQIES, which means that the record wasn't accepted. Rejected records are not saved in iQIES, and they have to be corrected and resubmitted in order to ensure that the data are accepted. You may also have some non-fatal errors warnings identified on the FBR. For example, when an MDS record is submitted late, you'll receive a non-fatal warning letting you know that the record was submitted late. Records that contain warnings or non-fatal errors are accepted into iQIES, but it's still important to review these non-fatal errors to ensure that the data submitted are accurate. Anytime there's a fatal error, no matter whether the non-fatal errors are included, the record will be rejected and must be corrected. Remember, even if there's just a warning error, providers should review them to see whether the information needs to be corrected and resubmitted. So here's just a small example of a warning and fatal error. The first one is a warning, and this is related to having a dash in an item related to a quality measure that may affect the provider's APU. And the second is a fatal error because there was a skip pattern that wasn't followed. Okay, so let's now move on to the next report, and that's the review and correct report. This report is user requested on demand, and as I said in the reporting overview, it's confidential to providers. The review and correct report includes assessment-based resident and facility level quality performance data and provides a breakdown by measure and by quarter, the provider's quality measure results for 4 rolling quarters. It's important to note that when new measures are added to the report, the 4-quarter display I just mentioned is iterative, meaning that for the first quarter, only 1 quarter displays, and then with each passing quarter, another is added to the report until a total of 4 quarters display. Once this occurs for the new measure, then the rolling quarters will go on from there. Providers can specify the reporting period of their choice to run this report and obtain the report for current and past 3 quarters. This allows providers the ability to review their quality measure data before it's reported on Care Compare and identify if any corrections to the data are necessary prior to the quarter's data submission deadline. Providers also have the ability to sort data on the review and correct report at the resident level by the resident's last name, first name, status, discharge date, and admission date. Be aware that the quality measure information on the review and correct report is not risk adjusted. The report is only going to include the observed scores, which are based on your raw MDS data. These reports are updated on a quarterly basis with data refreshed weekly as data becomes available for providers to run until the data correction deadline. Once that deadline is passed, that quarter's data is going to be rolled off and you will not be able to correct it. When one reporting quarter ends, data for a new reporting quarter will be available as early as the next day. That is, on the first day of the calendar month after the end of the prior quarter. Providers can use these reports in conjunction with iQIES reports like the FBR or quality measure reports to determine if there are any reporting inconsistencies or errors that may affect the facility's quality measure performance. Even though a correction deadline for a quarter passes and the data for that quarter are no longer updated on the review and correct report, it continues to be updated on the quality measure, facility level, and resident level reports. And even though the review and correct report does not offer providers specific client compliance information for APU, it is a tool that providers can use to assist in maintaining compliance regarding the accuracy of their MDS data. Providers can access the review and correct report in iQIES, similar to how the user requested FVR is accessed. So providers would go to Reports, select Find a Report, and choose the Review and Correct report from the list. The Review and Correct report can be filtered by quality measure by selecting the quality measure from the drop-down list. And providers can also include the resident level results by clicking the box underneath the quality measure selection prior to saving the criteria and running the report. So here's a table which shows the calendar year data collection quarter associated with the SNF QRP and the associated submission months, as well as the quarterly review and correct periods. Note that only data that are corrected and submitted on or before the data correction deadlines will be used in the calculation of the publicly reported measures. Data that are corrected and submitted after the data correction deadline are only represented in the confidential quality measure reports. So here's an example of the SNF review and correct facility level report for one of the measures, which shows the reporting quarter, the CMS ID, the start and end date, the data correction deadlines, and whether the data correction period as of the date of the report was run is open or closed. The report also shows the number of SNF stays that triggered the quality measure and the denominator, the SNF stays included in the denominator, and finally the facility percent. And here's an example of a review and correct resident level report. As you can see here, a particular measure was chosen by the provider and is displayed at the top of the report. The reporting quarter is also displayed along with each resident's name, ID, their admission discharge dates, the data correction deadline, and when the correction period is open or closed based on the report run date. The last column shows whether that particular resident has had this quality measure triggered. Remember that it's important to know the data correction deadlines and whether the data correction period is open or closed, because if there is something on the review and correct report that leads a provider to believe underlying data are incorrect, providers will only be able to correct that underlying data when the submission deadline for that quarter's data is open. Once the data submission deadline has passed and the data submission period is closed, the underlying data cannot be updated. It's also important to note the data for the CDC NHSN measures are not added to the review and correct reports, since these measures are stewarded by the CDC. In lieu of this, the CDC reports that are similar to the review and correct reports available for SNFs are available in real time for all data submissions of the CDC NHSN measures. They are referred to as CMS reports and can be found within the Analysis Reports page in the NHSN application. Now let's take a look at the SNF Provider Threshold Report, or PTR. It, like the Review and Correct report, is a user-requested on-demand report. The MDS assessment data for the SNF QRP PTR are updated in real time once the submissions are processed and the accepted assessments are saved into iQIES. The PTR provides details of the status of the measures required for the APU by fiscal year of the APU. The SNF PTR displays an asterisk for future monthly and quarterly dates when a measure is active, but the data are not yet available. Like the Review and Correct report, the PTR can be accessed under the Find a Report section in iQIES. The provider can specify the APU fiscal year of interest, and the details will display for that fiscal year. And here's an example of the SNF PTR. The top shows the chosen fiscal year for the report, the facility information, report run date, and data collection start and end dates. As can be seen here, once requested, the report will display the number of successfully submitted resident assessments and the number of resident assessments submitted that were complete, as well as the percentage of assessments submitted as complete. One thing to consider is that when looking at your fiscal year APU determination tables, that the data elements listed on those tables are limited to those used for determining SNF QRP compliance and are included in the APU submission threshold. But there are also other data elements that are used to risk adjust the quality measures used in the SNF QRP that are not part of the determination of the APU. If providers do not submit all of the data elements used to calculate and risk adjust a quality measure, it can affect the quality measure calculations that will be publicly reported on Care Compare. The last report we're going to look at is the SNF Provider Preview Report, or PPR. This is an automatically generated report that's issued by CMS in iQIES. The PPR is a confidential provider report and gives providers the opportunity to review their quality measure results on each quality measure prior to their publication on Care Compare. Providers have 30 days to review these quality measure results when the report is made available to them. Although the report will be available for 60 days, the review window is only 30 days. Even though at this point providers will not be able to correct any of the underlying data because the submission correction deadlines for the targeted periods will have passed, they can request that CMS review the data in the PPR if they believe the quality measure results to be inaccurate. So, for example, inaccuracies in the numerator, the denominator, or a quality metric. Requests for CMS review of the data must be made during that 30-day review period. So let's first take a look at how to access the SNF PPR and see what it looks like, and then I'll speak to how providers can request CMS review of the quality measure data displayed on the report. So to access the SNF PPR in iQIES, from the Reports menu, you'll select My Reports, and once again, on the My Reports page, you would locate the MDS 3.0 Provider Preview Report folder and select this link to open the folder. A list of reports available for download will be displayed, and you would just select the desired SNF PPR link, and the report will display. And here's a screenshot of the SNF QRP PPR with the preview of the data that will be reported on Care Compare. Under the Facility Information section, you can see the MDS Measures section, which includes the reporting period, the measure, its CMS ID, the number of SNF days included in the numerator and the denominator, the facility percent, and the national average. Should a provider want to submit a request for review, they should submit their request to CMS from the day the PPR is available through 11:59:59 Pacific Time on day 30 of the preview period. CMS won't accept any requests outside of this period. Send the request to CMS via email to the SNF QRP PPR questions at cms.hhs.gov email box with the following information in the subject line of the email: the facility's name followed by the words SNF Public Reporting Request for Review of Data and the facility's CCN. Within the request for CMS review email, the SNF should also include the SNF CCN, business name and address, and the CEO or CEO designated representative's contact information, as well as information supporting the SNF's belief that the data on the report are erroneous. Do not submit any protected health information or PHI with this request because CMS will not process the request if the SNF submit anything that has PHI within. If there is information which is pertinent to the request that contains PHI, be sure to redact the PHI prior to sending. After the submission request is sent, the provider will receive an email confirming receipt of the request, and if any additional information is needed, CMS will request it of the provider. CMS will review all documentation and provide a response outlining their decision via email. And data that CMS decides or agrees to correct will be displayed during the next quarterly release of the SNF quality data on Care Compare. If you would like to learn more about the reports and other functionalities in iQIES, please go to the link on the slide, which is the iQIES YouTube training channel. And for training on how to access SNF QRP reports for the NHSN measures, there are links provided on this slide and in the PDF handouts of the slides for each of the CDC measures.
Okay, let's go through a few knowledge checks about some of the things we have learned in this section. The first question is, which report provides detailed information about the status of select submission files? A, final validation report. B, MDS error summary by provider report. C, review and correct report. D, provider threshold report. Okay. And the correct response for this question is A, final validation report. The next question is, which of the following statements regarding the review and correct report is false? A, can be requested on demand. B, confidential to providers. C, only provides facility level QM data. D, displays 4 most recent quarters of data. Again, this is which statement is false regarding the review and correct report. Okay, and the correct response is C, review and correct reports, because they provide both facility and resident level data, not just facility level data. And finally, what is the purpose of the provider preview report? The options are A, allows providers to check compliance status of their data submission in relation to the required SNF QRP compliance threshold. B, providers' performance rates for assessment-based publicly reported QM. C, provides information so that providers can review and correct erroneous data. D, allows providers the opportunity to review their QM results prior to public display on CareCompare. Okay, and the correct response for this polling question is D. The provider preview report gives providers an opportunity to review their QM results on each quality measure prior to public display on CareCompare. And with that, I'll hand the presentation back over to Heidi.
Thanks, Jackie. I just want to say a little bit about that reports presentation. I would really urge providers to spend some time in iQIES, get comfortable with the information on the reports, and really learn how to utilize it to enhance your practices. It's a lot of information and it takes some time to go through, but it will there will be great benefits, I believe. So now that we've looked at the SNF QRP, including the MDS and NHSN data submission reporting requirements, the quality measures, the submission thresholds, and the reports, let's turn our attention back to how the SNF QRP compliance is determined. Let's start by looking again at the SNF QRP lifecycle and focusing on the green box when CMS makes the initial compliance determination. This determination happens in the first half of the calendar year. So for purposes of calculating compliance with the SNF QRP, MDS data submissions for the calendar year are reviewed against the requirements of the SNF QRP. The first requirement is the submission and acceptance of matching MDS assessments to construct a Part A SNF stay, so an admission and discharge or an admission and death in facility tracking. This is about submitting the correct MDS assessments. And then MDS data are required to be submitted by the established quarterly deadline. So this is the blue and white chart we looked at several times. It is 4.5 months after the end of the quarter. The next data submission deadline is May 15th, 2024, and that is for quarter 4, 2023 data. So in addition to the timing of the MDS submission, there's a completeness requirement as well. This completeness criteria was increased, as we already talked about, in the fiscal year 2024 SNF PPS rule from 80 to 90%. What that means is currently 90% of the assessments received must contain 100% of the required data. For measure data collected and submitted using the CDC NHSN, SNFs must submit 100% of the data used to calculate the 2 measures that we discussed for the COVID-19 vaccination coverage among healthcare personnel. Data must be submitted for 1 week out of every month, but SNFs have the option of which week to report, influenza vaccination coverage among healthcare personnel. SNFs must submit a single influenza vaccination summary report at the conclusion of the measure reporting period, which will be May 31st. Any SNF that doesn't meet the requirements of the SNF QRP will be considered non-compliant and subject to a 2% point reduction in their APU for the applicable fiscal year. CMS will notify SNFs of non-compliance in a couple of ways: letters sent from the Medicare Administrative Contractor, or MAC, and a letter placed in the My Reports folder in iQIES. This notice will include the reason or reasons for failing compliance and instructions for requesting reconsideration of CMS's decision. It is important to pay attention to the reason for failing compliance on the notice, because if a decision is made to submit a reconsideration request, the documentation submitted should relate to the reason for failing on the notice. I want to note here that only those SNFs who are considered non-compliant and subject to the reduction in their APU will get a letter. Compliant SNFs will not get a letter. If a SNF receives a notice of noncompliance, they have the opportunity to request a reconsideration, which is a request for review of the CMS initial compliance determination for a given SNF or swing bed facility for a given fiscal year. SNFs may file for reconsideration if they believe the CMS finding of noncompliance is an error, they have evidence of the impact of extraordinary circumstances which prevented timely submission of data. It's important to note that requests must be submitted within 30 days after the date documented on the noncompliance notification letter. No request will be accepted after the 30-day deadline. Again, it's important to note that requests must be submitted within the 30 days after the date documented on the noncompliance letter, and no request will be accepted after the 30-day deadline. Now, if a SNF decides they want to submit a reconsideration request, the request must be sent via email to the SNF QRP reconsiderations email box listed here, and the subject line needs to say SNF QRP reconsideration request and should contain the SNF CCN. Do not submit reconsideration requests to your MAC. Be sure to include the information below on your request: the CCN, business name and address, the CEO or designated contact information, the CMS identified reason for noncompliance from the notification letter, the reason for requesting reconsideration, and information supporting the SNF's belief that either the finding of noncompliance is an error or the evidence of the impact of extraordinary circumstances which prevented timely submission of the data. Always want to include supporting documentation demonstrating compliance, which could include something such as proof of complete and timely submission, email communications, data submission reports from iQIES, data submission reports from the CDC NHSN system, proof of waiver approvals for exceptions or extensions for the reporting timeframe, or notification of the CCN activation letter to prove that the CCN was not activated by the end of the reporting quarter, or other documentation that may support the rationale for seeking reconsideration. It is important to understand that the determination to uphold the original finding of noncompliance or overturn will be made solely on the documentation provided by the SNF in the reconsideration request. CMS will not contact the SNF to request additional information or to clarify incomplete or inconclusive information. So make sure you send all the documentation you need to support your reconsideration request. However, it is also important to note that reconsideration requests that contain protected health information, or PHI, will not be processed. If you are sending any reports that contain PHI, you need to redact the PHI prior to sending. After the reconsideration request is submitted by the SNF, CMS should acknowledge receipt of the reconsideration request within 5 business days through an email. Following the review of the request and supporting documentation, reconsideration request decisions are distributed by the MAC and an electronic letter through iQIES. If CMS upholds the initial finding of noncompliance, a SNF may file an appeal with the Provider Reimbursement Review Board, or the PRRB. Details on appeals are available on the PRRB website. You must follow the instructions listed on the website to file with the PRRB. If the amount in controversy is at least $1,000 but less than $10,000, then the Federal Specialized Services will manage the dispute as an intermediary hearing. Requests for an intermediary hearing should be sent electronically to the intermediary appeals mailbox. So here are some reconsideration process do's and don'ts to help ensure your reconsideration request is ready to submit to CMS. Do be sure to send reports demonstrating compliance with all PHI redacted. Do submit your reconsideration request prior to the deadline, which is within 30 days after the date documented on the noncompliance notification letter. Do ensure you receive an email confirmation of receipt of the reconsideration, in addition to the automated response from the mailbox. And if you do not receive that email acknowledging receipt, resubmit the request. Don't submit PHI. Don't submit an email that is larger than 20 megabytes. Don't submit reports from third-party vendors. Again, I'd like to stress, I can't stress enough, do not submit PHI. That will, any reports with PHI will not be reviewed. So this slide lays out the estimated reconsideration process timeline. These timelines are the same as the timelines laid out on the SNF QRP Lifecycle slide we reviewed earlier. If you're more of a visual learner, again, within the early summer, June to July, non-compliant SNFs that fail to meet the requirements are notified. July to August, reconsideration requests are due to CMS. Again, we say July to August, but the final date is really no later than 30 days from the date on the notice of noncompliance. September, CMS notifies SNFs of the decision on any reconsideration request submitted. And then in October, the APU penalty is imposed on SNFs found to be noncompliant with the QRP requirements.
Okay, let's do a couple more review questions. Which of the following statements regarding the reconsideration process is false? A, SNFs have 30 days to submit a reconsideration request. B, CMS contacts the SNF if it has further questions. C, requests can only be sent by email. Or D, CMS issues a decision by regular mail and via iQIES. Which statement is false? Okay, thank you for those responding. The correct response for this question is B. CMS contacts the SNF if it has further questions. As was pointed out in a previous slide, CMS will not contact the SNF to request additional information or to clarify incomplete or inconclusive information. So make sure that you send all the documentation you need to support your reconsideration request. Finally, what is the NHSN data submission compliance threshold for the SNF QRP? A, 50%, B, 75%, C, 100%, D, the compliance threshold for NHSN is not part of the SNF QRP. Okay, great. And the correct response for this question is C, 100%. Providers must submit 100% of the NHSN data for the required measures. And now I'll hand back over to Teresa for the resources.
Let's go over some of the resources for providers. First, we'll start with the SNF QRP webpage. And on this page, there is a navigation menu on the left side of the screen, which includes links to various subpages for specific information. For example, one can navigate to the SNF reconsideration and exception and extension webpage, where the information that Heidi just spoke about can be found. That's just one example, but as you can see on the screen there, that there are several areas within the main SNF QRP website where you can link to important program announcements, information on health equity, measures and technical information, information on public reporting, FAQs, and much more. Another important webpage, which is housed on the NHQI website, is the MDS 3.0 manual webpage. On this page, you can download the most recent MDS 3.0 Resident Assessment Instrument, or RAI manual, item sets, and information on the state RAI coordinators, who are first of the line folks when it comes to responding to MDS coding questions. The state RAI coordinator contact information is found in Appendix B of the RAI manual, which is available as a separate PDF downloadable document. Appendix B also has information about state MDS automation coordinators who can, for example, help with transmission of MDS test data for new SNPs. A third very important website to be aware of that we've mentioned a few times now is the IQIES Technical Support Office, or the QTSO website. Within this website, you'll see there's a section for nursing home MDS and swing bed providers. Along with news and updates for providers, there's information about iQIES training, how to get access to the system, and there's also a section where providers can view and or download references manuals. Of note, there are 3 specific manuals that should be very helpful. The first is the iQIES MDS Upload and Assessment User Manual that provides detailed information about submission of MDS data into iQIES. There's also the iQIES Reports User Manual that speaks to the different reports that are available for providers. And finally, the MDS Error Message Reference Guide, which I mentioned previously when discussing the error and warning messages during the file submission and processing. On this slide are the various help desks that are available for SNFs. There's an overall SNF QRP help desk, a SNF QRP public reporting help desk, a help desk for iQIES, one for SNF reconsiderations, as well as APU compliance outreach help desk. And this graphic depicts all the resources and help desks for SNFs. We've had lots of providers say that these graphics are helpful aids that can be printed or saved on their computer for quick reference. And just one more thing before we move on to the questions and answers portion of the webinar, you may want to know where you'll be able to find the recording and slides for this and other trainings that we've done for SNFs. These can be found at the SNF QRP training webpage link in the left navigation menu of the main SNF QRP webpage. On behalf of Heidi and I, thank you so much for your time and attention to the presentation, and I'll turn things back over to Jackie to get the Q&A started.
Thank you again, everyone. I know we're running short on time, but we provided a lot of information that I hope was very helpful, and now we're going to go over as many questions as we can in this time. So our first question is, CMS mentioned on an open door forum that the GG0130 self-care and GG0170 mobility discharge goals were no longer required to be answered, and dashing those would not impact the QRP threshold. However, in reviewing our threshold report, those questions do impact. Terry, are you able to respond to that question?
Yeah, sure. And I did see this question in the chat, so hopefully this helps. So as identified on the fiscal year 2026 APU table, it states that beginning October 1st, 2023, at least one GG0130 self-care or GG0170 mobility discharge goal item is not required to be coded to fulfill requirements of the SNF QRP. CMS plans to remove the self-care discharge goals and mobility discharge goals columns, so column 2 for each of those data elements, within the next release of the MDS planned for October 1st, 2024. However, SNFs will continue to receive an APU warning if an MDS is submitted to iQIES without at least one of those self-care mobility discharge goals listed. SNFs can ignore those warnings and just proceed with submitting the assessment. The provider threshold report update is planned for January 1st, 2025, and it will be updated to no longer consider those items in the determination of the APU compliance. Once the report logic has been updated, the number of MDS 3.0 assessments submitted complete and the percentage of MDS 3.0 assessments submitted complete results on the report will automatically be updated to reflect that the goal items are no longer considered in APU compliance calculation.
Okay, thank you. For our next question, specifically, how can a provider update the organization's context for who should be receiving the quarterly notices of noncompliance emails? Heidi, if you can answer that one.
Sure. Swing Tech, which is a CMS contractor, sends informational messages to SNFs that are not meeting the annual payment update threshold on a quarterly basis ahead of each data submission deadline. If you need to add or change the email addresses to which these messages are sent, you can please email the QRP help at swingtech.com and be sure to include your facility name and CCN along with any requested email updates so that you will receive this outreach.
Thank you very much. And on to our third question. Are updates to the RAI in progress for unplanned discharges? We are unable to complete interviews and many times are forced to use a dash and don't want to be penalized for the use of dashes. Will CMS be allowing more time to complete and transmit the MDS in the future? And Heidi, if you can take that one as well.
Sure. When an interviewable resident is unexpectedly discharged, and given the brief time frame the resident was in the facility, the staff did not have the opportunity to conduct the interview, the assessors should code 1 yes in the interview gateway items, for example, if it were D0100, and then enter no information or a dash in the interview itself. If the unplanned discharge assessment is combined with a PPS assessment, the use of a dash can have a negative impact on the facility's skilled nursing facility quality reporting program compliance. If this is a common occurrence, the facility may wish to adjust its practices to ensure the interviews are conducted as part of the admission assessment process. The time to complete and transmit MDS records outlined in the MDS 3.0 User's Manual aligns with the federal regulations available in Appendix PP of the State Operations Manual. CMS does not plan to adjust these timeframes.
Okay, thank you. And I think we have time just for one more. Can you please discuss the NHSN requirements and who specifically to contact that can provide help? Terry, are you able to take that one?
Yeah, sure. So we covered the NHSN requirements in the presentation, so I'll focus on where providers can actually go for help with the NHSN. The NHSN has a portal called NHSN Service Now, which can be accessed via the Secure Access Management System, or SAMS, which is where you go now in order to log into NHSN. All ServiceNow tickets are answered by an NHSN team member. So when you go into this portal, the quickest way to get help is if you submit a ticket using the categories and selections that are available in the system. And this is going to ensure that it gets triaged to the right person more quickly. So for vaccination related questions in the ServiceNow platform for the component area, any questions you have related to the COVID-19 vaccination, select long-term care. And for questions related to the annual influenza vaccination, you're going to select healthcare personnel safety. And for category area, you're going to say that the facilities can select, for category, the facilities can select the COVID-19 vaccination or flu vaccination category. And then there's a description box where you can write in SNF QRP or COVID-19 vaccination long-term care facilities or annual HCP flu vaccination long-term care facilities, just so that they know a little bit more about the request that you're asking about. And for long-term care component modules questions, under the component category, facilities can just select long-term care. And then for the category, facilities can select COVID-19 / respiratory pathogen reporting, or HAI. And then in the little description box, just enter a short description that will help identify the question or issue that you need help with.
Okay, thank you very much. This now concludes the SNF QRP Achieving a Full APU webinar update. I'd like to thank our presenters for sharing their knowledge on today's webinar, and this presentation will be available on the CMS SNF QRP training webpage. You can follow the link that has been provided in the chat to sign up for notifications for when resources are released and when future trainings are available. Thank you all so much for attending, and enjoy the rest of your day.